COVID-19 challenge. In December 2019, a mysterious new virus called corona was alerted in China and it was spreading through their community. In the following week, it spread all over the world with cases doubling within days. The infection killed over lakhs of people and spread quickly to other countries. In India, the infection started with 3 positive cases and today they are reaching nearly 1 lakh positive cases. The World Health Organization has declared that the COVID-19 outbreak a public health emergency of international concern. The spread of infection is majorly through aerosol, droplet and contact. Healthcare workers every day come in contact with many patients and people in the healthcare, and also evidence report that 81% of people won't show any symptoms of COVID-19. The healthcare facilities is one of the primary source of spreading infection as it has hotspots such as emergency, pediatric, women and outpatient departments. As this infection is dreadful and will stay with community for longer time and it needs a solution to prevent. We have put up our challenge in 10 points on how to avoid COVID-19 infection in a healthcare setting. Point number 1. Strictly stick to one person for accompanying the patient during hospital visit and stay. The second point, avoid vehicle entry into entry point except for ambulance or hospital transport vehicles. The third point, sanitization. Hand is being sanitized with the sanitizer and the foot is sanitized by a laser device placed at the entrance. The fourth point is with regard to mask. Mask is an only effective way to prevent the spread of infection along with hand hygiene practices. The mask will be given at the entrance to wear. For patients, surgical mask will be given as per the infection policies of the hospital, and for accompanying person, normal cotton mask will be provided. The cotton mask locally made with a layer of cotton cloth. They are affordable, easy to use, to wash and to sterilize. Wearing a mask will minimize touching the face as it is being reported that an average human being will touch his or her face 3000 times per 24 hours. This mask will act as a deterrent. As we know that masks can be reused as they are made up of cloth fabrics which are reused by washing with soap and water and drying under sun, which will minimize the spread of infection and thereby curtailing the infection. Coming to the fifth point, social distancing. The social distancing will be done through placing the people in 6 feet distance. Coming to the sixth point, it's about temperature checking. A non-contact infrared thermometer device will be used to assess the temperature. If the patient is having a fever, then he or she will be transferred to the designated respiratory ICU as identified by the hospital. The seventh point, scheduling. Healthcare administration should schedule time for the patients which minimizes the crowding. The eighth point, if the patient detected with temperature, mobile tracking system activated to avoid unwanted movements in the healthcare setting. Coming to the ninth point, facility for navigating with the department through a map navigator. The last point or the 10th point, the telemedicine consults will be done to minimize hospital visits from remote areas. The sanitizing the hand, applying foot cover, providing face masks, maintaining social distancing, assessing temperature should take place at all hotspots of the healthcare facilities. COVID-19 challenge is designed in an ergonomic way where it is cost effective and can be used by all the people at all levels of healthcare and all the hotspots. It can be applicable at all levels of healthcare setting such as community gathering, schools, colleges and university campuses, hospitals and community centers. With this brief description, we wanted to share our idea for COVID-19 challenge. It is a small impression for making big difference, and this is an attempt to put our idea. Idea is made by Dr. Ramya, Emergency Department, KMC Manipal, along with Mrs. Sulochana. Thank you.